health workers. Government has been putting up new health units and has recruited over 2,000 health workers. But it has been found out that over 1,000 workers don't turn up for the job. And then we still point fingers at the government and say, government, we don't have where to work. And then when we're given jobs, we don't turn up.
Ntambudde mu malwaliro ga wano mu Kampala wonna ne ntuukako e Mulago naye abasawo gye bali n'ekizibu ekiriyo bakuwandiikira buwandiikisi ddagala naye temuli wadde eddagala n'akamu otuuka muli n'okaaba n'amaziga otuuka wansi ku bitanda abantu basula wansi ate nga gavumenti erina ssente esobola okuzimba amalwaliro.
Let's look at it this way. We've said we don't have enough health facilities, and the government has put up very many health centers and has recruited people, over 3,000, and then 1,000 refused to turn up to work. Why would someone refuse to go to work?
Omusaala babawo omusaala mutono. Bw'otunuulira omusaala South Africa. Dokita ali milioni 4. Dokita nze nafuna chance n'engenda yuko muganda wange gyali. Naye dokita afuna milioni 4, nansi afuna milioni 2. Kyewunsa okulaba nga dokita owaffe owawano taweza wadde na milioni. Kyovula nti badduse bagweredde South Africa bagenze e London bagenze wa.
Back to the point. Why people refuse to go there to work when they are looking for jobs. Number one, when looking for a job, you're looking for a better stage from what you've been
to improve.
When looking for a business, you're looking for a better stage from what you've been, from poverty to richness. It's not a matter of avoiding redundance at home or anywhere you are, just because you're jobless. So when looking for a job, you're looking for a better life, a better stage to improve, to get a better life than what you've been. So when you see you have been looking for a job, now you're recruited and the difference is 0. So why should you go there?
My point is, first of all, when you join medical school and you're a doctor or a nurse, some of these guys are forced to do those courses. That is the first thing. And
parents force them to take up medicine.
Yes. And they are done with the 5 years. You have that 1 year of intern, and
they've spent so much money.
They've seen all these guys sick, and the conditions are really not that nice. So at the end of the day, what someone wants is to work in a private hospital like Case, and out of the blue they are telling them you have to go to Change Jojo in some deep village, and these guys have their tablets, Samsung Galaxy S4, and
there's no network
there. As in, someone looks at that life and they're like, I would rather stay in Kampala and maybe take on business and move on, just like that.
Okay, some bit of information. Early this year, Ministry of Health official told Parliament that over 4,000 health workers had turned down their government appointments at health centers 3s and 4s. And then we go around complaining, and this happens in our villages where bagara jajawa afune dagara afune treatment, and they build health centers. But when they post Ngabwa Gambia, she's 2.com in an iPad, when they send that qualified doctor to the village, Agamba Achikafu, I'm not going anywhere. Yeah, I'm not going anywhere. Why? You had something to say, sir.
Abantu abamu agenda nasoma kuva butobwe abamu akulidde Kampala oba Mukono oba Jinja kati nagenda asaba omulimu apply nze Jinja district o Mukono naye omulimu okubanga oba n'option ogumuwa ne bamusindika Kanungu mutuufu agenda okuba sente zibamuwa ne life gyagenda okubaamu ng'asigadde Kampala n'okola ebirala oba osinga.
Kati ffe mu paako omwo tulinamu dokita yadduka mu bwa dokita e Mulago avuga taxi ku kamwe kya stage.
Mwina dokita
yali akula mannyo n'ate nga kalusawa yalera abantu abalwala amannyo bangi n'ekikwewunyisa bambi musajja wattu yagenda okulaba embeera, yagenda okubala sente zajja mu taxi nga zisinga. Kati ali mu paaka avuga motoka era mu akadiite yakamalamu emyaka 10 ali mu taxi.
And he told you that?
Muzee ali awo kamwe kya stage mu parking kadi era musobola okujja ne mumulabako.
Ewafe waliyo eddwaliro ku kyalo.
Eddwaliro ki?
Erese center 1. Naye kuliko abasawo ndowooza babiri.
Ku ddwaliro lyonna kuliko abasawo babiri.
tukozesa sola naye ngewaffe kumpi si wala ekinene nnyo bw'oba obala okuva ku main Masaka road kukyamamunda ziriwo mayiro 4 emiti gy'amasannyalaze ndo tegiyinza nagenda miti giwera 100 naye amasannyalaze waffe tetulina kati tosobola kujja muntu wano mu kibuga n'omutwala wali waffe nga tulina mazzi tulina masannyalaze nze mbadde nsaba gavumenti bw'eba esobola ozimbawo eddwaliro awantu ngaawo.
So those two doctors kambuuze basulawo bakulirawo oba babeerawo
babaleeta bulesi naye tebasobola kujja ne bamalawo mwaka
baddukayo
olw'embeera kati eddwaliro libeerawo nga teririna ddagala. Nze kitange maama wange kwenzaaliddwa buli kimu era omukubira essimu nagamba ngenzeeko mu ddwaliro naye nga teri ddagala nafuna panado era eddagala ndigula Kampala nenditwala kati nze mbadde ngamba gavumenti bw'eba esobola ojja nezimbawo eddwaliro n'ebyetaagisa nabyo esobola obituusaawo
ekwate n'ababbi ababbase
ebyetaagisa nga ki
kuba tulabye ng'obulamu obukalubirira abantu oba badokitazi atubeera wano mu kibuga amasannyalaze wegali amazzi wegali ng'obulamu bwe butambula bulungi awo empiki tewaliwo netiwaaka weegulira naye ebintu ebiremesa abantu eddwaliro temuli ddagala tewali masannyalaze tewali mazzi alaba ng'obulamu bukaluba nnyo era ekivaamu addukayo n'akola wakiriga klinika ke mu tawuni ngaawo n'abeeraawo kikimbadde nsaba gavumenti.
We had an opportunity to talk to Dr. Diana Atwine. She's a director of Medicines and Health Delivery Monitoring Unit. Katutunule tulabe ebyayogera since she's in the field, then bwe tukoma tulabe what is the solution, because whether or not we want it, njagala manye nti jajja mu kyalo bwe tusendingayo sente agende mu ddwaliro atukeyo bamukebere tuyiye solutions fe twefuule nti tulinayo ka parliament akaffe singa kisoboka twandikikoze bwe tuti. Let's take a look at Dr. Atwine and we'll be right back.
There are some health workers, 2,000 of them, despite being having been recruited, they are not accessing the payroll. Number two, there are health workers that have been employed, given appointment letters. Up to now, they have refused to report to the areas where they were recruited to work in. And months after months after months. Now, that is actually partly the problem of the supervising officers. The district health officers in the district is mandated to ensure that if you are given an appointment letter, you report. And actually in the letter, normally it is stated, you are expected to report with immediate effect. Standing orders in public service, they are very clear, very elaborate. If you fail to report, they are supposed to warn you, they're supposed to give you a letter, warning letter. Failure to do that, they reprimand you. Failure to do that, they strike you off the payroll. If we can set some rules of the game and say, what does it mean to supervise? Because each one defines supervision as, if I come around and I stop in the compound there and you come running with a visitor's book, I have done supervision. No wonder every time, every health facility I go to, everyone will come running with a visitor's book that you sign in. So if we can really define what is good supervision, I think we shall be there.
Dr. Atwine agamba nti supervision bwe buzibu. And when they send doctors, they don't send people to go and supervise. When they reach in the compound, badduka ne visitors book signing, so to show you've appeared, but really no supervision is done. And then the LOCs are supposed to go to hospital balabe bananga madwa nemulowooza nti kisoboka ekyo nti local leaders bagende ku ddwaliro balaba oba abakozi gye bali
enguzi nga bwesusi tekisobola kukola makulu kyetusaba gavumenti ekendeza omusala gw'ababaka ba palamenti sente zibafuna nyingi ate nga teboogera tusaba abasawo babazimbira amayumba amalwaliro gye bagatadde babeere nga basula mu nnyumba za bwereere okusinga okupangisa wakati omusawo muwadde emitwalo 26 alina okupangisako ennyumba abaana basoma olwo abanga akolera obwereere sente ezibbibwa mu basajja ababba sente nabo bakwatibwe.
What kind of motivation are we going to provide? So that if they post me right now in Imparotitanga and they tell me there's a hospital, I go and work, I'll be motivated to actually go there. What are those what are those things we should do to encourage doctors to actually go to those places and stay there and work?
Number one, in general, it should be facilitation, housing, transportation, and salary increment. Otherwise, apart from those, nobody can work in remote areas. In remote areas, sometimes you find difficulty in transportation, leaving your home to the remote areas. Every day you have to hire. Housing, when you go there, you don't have accommodation. You have to hire in the center, trading centers. Some people you find them there. You can imagine in Makere, a doctor from Makere, he goes to hire a house in the trading center. Water, sanitation, you find it. They go to Ruzi to collect water instead of tap water in the hospital. So that's kind of facilitation. If it is improved, plus salary and whatever, then a man can go there, or either you can go there and work comfortably. Earlier, in former days, you could earn your living from your salary. But when you go there and you don't earn from your salary, so what are you going to do there? It is a waste of time, showing yourself there, and maybe you're avoiding redundance at home. So I think those three issues, at least if they are done, then at least people can relax and work.
Wanze subira aliwo omuntu atasobola kukolera nga sente zibamuwadde zisobola omumatiza ne bonzijano ngontwala ne banga aira ako Afghanistan zompadde nsobola okukolerawo.
I'm thinking by the time you say ngenda kuba midwife, your goal in life is to save as many lives as possible, not to make as much money as possible. Isn't that lack? I think it's one piece of kutunulira sente instead of looking at your calling in life.
Why do you look for a job? Why are you looking for a job? You're looking for a job to improve your survival. So when you go there and you don't get your survival, so what are you going there for? I think you better start home. And at the same time, you say these people should have some sort of a spirit of saving people's lives. How can an empty bag stand? So you have left home when you are you're hungry. Then how do you go to hospital to save that one, save somebody's life when yours is on a verge?
Well, the most given reasons, like we've seen, the poor working conditions. There's also delayed remuneration. Centers are, but you can imagine you work for 3 months, but even the salary for the other months you haven't received them, but you're still working. So there's also that bogs their energy down.